Hi everyone, I'm Dr. Karam. I'm a board certified facial plastic surgeon and I specialize in facial rejuvenation procedures. And today we're going to talk about a question that comes up a lot. And that is, if you have had a thread lift or considering having a thread lift, can you still have a facelift later on? So before we jump into that answer, let's talk a little bit about what thread lifts are and what they're designed to correct. So effectively, the face ages by sagging. A lot of times this happens in the early 40s, mid 40s, late 40s, and early 50s and beyond. And the changes are jowling, heaviness in the neck, the outer brows start to come down. And as a result of those changes, people get distraught and they want to correct them because the whole shape of their face is starting to change and they don't want it to go on. So as a result, there's some non-surgical options out there that are designed to correct these problems. And we'll talk about whether they're effective or not in a moment, but let's talk about what they are. So one of those non-surgical treatment options are the thread lift. The thread lift it was originally described in 15, 20 years ago in a number of different settings, but one of the main components of it is basically originally a non-dissolving thread with little barbs at the end of it, which then are passed through the tissue, and then the soft tissue of the face is lifted over the threads, and then the barbs catch the skin and the fascia and ideally hold the face up as a result. And then you suture down the threads and they're effectively in your face. So as barbaric as that sounds and as strange as that sounds, that is a technique that was widely available 15, 20 years ago. And what happened is they realized that those particular treatments were very painful, they had a high complication rate, and they weren't very effective. Like in a 3 to 4 month period, 6 month period afterwards, everything started to loosen up again. So that concept of a non-dissolving thread disappeared. Now, today, 10, 15 years later, we have a new type of thread lift that's come out, which is the PDO or dissolving suture. So the idea with these PDO threads are that they're placed the same way, same concept, but in about 6 months they go away. And the idea was that they're going to diminish some of the complications that are associated with permanent sutures. And the idea is that when they go in there, that perhaps the scar tissue caused by collagen would hold the face in place, but unfortunately that also doesn't actually happen, and as a result, within about 6 months, maybe maximum a year, everything kind of goes back to normal, and really doesn't create much of a change if you have significant laxity, like if you're in your 50s and starting to consider this. Now, despite this, it obviously sounds really good. There's no incisions involved. It's under local anesthesia. So there's a lot of people out there that are either considering getting threads done or have already had them done. And for those individuals, when they don't work, then it leaves this question of, can I now then go have a facelift, or did I burn a bridge? So good news is, as a result of these thread lifts, you have definitely not burned any bridges. It certainly does make the operation a little bit more difficult. There's scar tissue, you run into these threads, they're in our way a little bit, but for an experienced facelift surgeon who specializes in these type of procedures, they should be able to navigate through those little obstacles and ultimately achieve the result that we're hoping for, despite the presence of the threads. And for me, on a given week, I might see 2 or 3 patients who've had a history of threads in their face. So I'm very used to working with them, and I don't feel that it's ever inhibited or affected the ultimate outcome. So that's the good news. And I think the bigger picture is, be very selective about procedures that you're going to have. If you don't feel you have strong evidence that this is going to be effective for you, you probably shouldn't be doing them in the first place. But if you do them, don't worry, you can still have a facelift and still get that beautiful jawline and neck that you have always wanted. So I hope that helped answer this question that comes up a lot. Please feel free to share this with your friends and family that may also find this information helpful. And if you haven't already, please subscribe, share, and like this video so we can get it to more and more people and help educate all of our friends out there. Thanks so much, Dr. Karam.